This lesson is about the cardinal rules of radiation safety. Radiation is both good and bad. It's good because it helps us to diagnose diseases and injuries in our patients, but radiation is also bad because it's known to cause cancer and other biological harms to human beings. Fortunately, there are 3 simple rules that you can follow to protect yourself and your patients from the harmful effects of radiation. The cardinal rules of radiation protection are time, distance, and shielding. Time, distance, and shielding are all radiation protection mechanisms used to implement what we call the ALARA philosophy. So what is ALARA? ALARA is an acronym that stands for as low as reasonably achievable. It's a general philosophy about radiation protection, and it's the law. The ALARA rule simply means that the radiation dose to patients, the public, and occupational workers should be kept as low as reasonably achievable. Not as low as possible, but as low as we can while still providing quality medical imaging to our patients. Each cardinal rule of radiation protection affects radiation dose in a very predictable way. We'll start by talking about time. A person's time in a radiation field should be minimized because the relationship between exposure time and radiation dose is directly proportional. As an example, as we increase our time in an exposure field, this will increase our radiation dose by the same amount. Obviously, our goal is exactly the opposite. We want to decrease our time in a radiation exposure field, which then decreases our radiation dose. Here's an example of how this rule affects patients. Let's say a patient has a fluoroscopy procedure which lasts for exactly 2 minutes and the patient receives a radiation dose of 100 milligray. If we have to double the fluoroscopy time up to 4 minutes, this will double the patient's radiation dose up to 200 milligray. Obviously, our goal would be to reduce the fluoroscopy time. If we do reduce the fluoroscopy time by half, down to 1 minute, this also reduces the patient's dose by half, down to 50 milligray. This idea can also be applied to the total number of radiological procedures. As an example, as the number of radiological procedures increases, this increases the dose to the patient. And that's why radiological procedures should only be performed when medically necessary and when the benefit of the procedure outweighs the potential risk. The second cardinal rule of radiation protection is distance. A person should always maximize the distance between himself and the radiation source. In other words, increasing the distance between yourself and the radiation source will actually decrease your radiation dose. And keep in mind that the opposite would also be true. If you decrease your distance from the radiation source, in other words, if you get closer, this will actually increase your radiation dose significantly. Let's look at an example of how this works. Let's say that you're standing 1 meter away from the radiation source during a surgical procedure. If you take just 1 step backwards and double your distance to 2 meters, your radiation dose decreases by a factor of 4. If you take 2 steps back, your radiation dose decreases by a factor of 9. So increasing your distance from the radiation source is a very simple way of decreasing your radiation dose. The last cardinal rule of radiation protection is shielding. Sometimes it's impossible to step away from the radiation source or minimize your time around the radiation source. So in those situations, it's very appropriate to use protective lead shielding. If you're working near a radiation field, you should at minimum wear a lead apron and a leaded thyroid shield. Shadow shields and contact shields are sometimes used on patients to reduce their radiation dose, and even the walls and doors of X-ray rooms also include lead shielding to protect people outside of the room. The amount of radiation dose reduction depends on the type of shielding material and the thickness of shielding material, and this makes sense. If we increase the thickness of the shielding that we're using, this of course is going to decrease our radiation dose. The other thing to understand is that not all materials are the same. If we use materials with a very high atomic number, like lead, this is going to result in a significantly decreased patient dose. So in summary, The general philosophy and federal law for radiation protection is the ALARA rule, which stands for as low as reasonably achievable. The ALARA rule can be accomplished by exercising the 3 cardinal rules of radiation protection: time, distance, and shielding.